Module 4 – Clinical Risk Factors. A wide range of clinical risk factors are associated with higher falls risk and fall-related injury risk in older adults. Here, we focus on 3 specific clinical factors: cognitive impairment, Parkinson's disease, and visual impairment. Cognitive impairment. Cognitive impairment can occur due to a wide range of diseases and conditions, including stroke, dementia, or TBI, and is characterized by difficulty remembering, learning, or making decisions. Older adults with cognitive impairments fall 2 to 3 times more than older adults without cognitive impairments, and are less likely to recover from fall-related injuries. Here, a resident with a cognitive impairment attempts to sit on a chair when there is no chair, which is a common occurrence in older adults with cognitive impairments. Some older adults with cognitive impairments might also forget to use their mobility aid. However, despite greater falls risk, many individuals with cognitive impairment retain the physical ability to execute responses such as arresting the fall with outstretched hands to avoid head impact. Doing strength and flexibility exercises can help preserve and enhance these responses. Keeping mentally and socially active by learning new skills and participating in social activities have also shown to reduce rates of cognitive decline in older adults. Parkinson's disease. Parkinson's disease is a progressive neurological disorder that leads to tremors and rigidity and difficulty with walking, balance, and coordination. Older adults with Parkinson's disease are twice as likely as older adults without Parkinson's disease to fall, and 9 times more likely to have recurrent falls. Here, we see a resident with Parkinson's disease experiencing a sudden, short episode of being unable to move their feet while walking, which is characteristic of Parkinson's disease. Older adults with Parkinson's disease also tend to have small, ineffective stepping responses for balance recovery. Here, we see a resident take a few quick, short steps in attempt to recover their balance. It is important for individuals with Parkinson's disease to regularly review medications with a GP or specialist. Changes in walking, such as slowed movement, shuffling steps, and gait freezing, can be related to medication cycles. It can also help to focus on taking long steps. Individuals with Parkinson's disease lose automatic movements, so actively thinking about movements that would otherwise be automatic can help. Visual impairment. Visual impairment is an impairment of visual functioning, even after treatment and/or standard refractive correction. It is caused by various conditions such as cataracts, glaucoma, and macular degeneration. Visual impairment makes it harder to make effective balance adjustments, which can increase falls risk. This resident with visual impairment appears unsure where to move after losing balance. During the fall, they reach out for the table in front of them, but miss and end up hitting their head on it. Visual impairment also limits a person's ability to identify raised obstacles such as curbs and steps, which increases the risk for tripping. Here, a resident with visual impairment trips over a sign on the floor as he walks down the hallway. Fortunately, interventions to correct visual loss, such as cataract surgery and replacement of multifocal lenses, have been shown to reduce falls risk. Environmental modifications such as removing unnecessary furniture, applying high-contrast tape to the edges of stairs and other non-removable obstacles, and using night lights can also help reduce falls risk.